I completed a PGY1 and PGY2 here at UVA, and one of the biggest reasons that I came here initially was the community atmosphere that I felt. Everybody was incredibly friendly on interview, and then I continued to see those same qualities as a PGY1, PGY2, and now a new pharmacist working on the critical care team. Everybody in general is so supportive and encouraging as newer practitioners are learning to develop their skills. And so I've really enjoyed that and really enjoyed being a part of the UVA family.
First of all, UVA is a teaching hospital. At the end of the day, we're all still students in this life, so you gotta make sure you're always learning. Whatever you want to do, we're here to help. And whether it's become a nurse, whether it's become a pharmacist, or whether it's just become a seasoned technician, all those opportunities are here for you at UVA.
Students coming to the UVA satellite campus for their 3rd and 4th years really have a wonderful opportunity to become part of a smaller cohort. We have between 8 and 11 students in the P3 year, so we have a lot of one-on-one interactions, small group discussions that would be different than some of the other campuses. The total residency class is 22 residents, and we're providing them a first-class clinical experience as well as project management, leadership development. We have an incredible collaboration between our P3 and P4 students and our residents to really implement the layered learning model. The training of learners is really part of our educational mission and something that we all invest in. So we have a large group of preceptors for both our residents and students, upwards of 80 preceptors. That's a large number of well-trained, highly experienced, and in many cases board-certified pharmacists teaching the next generation of pharmacists.
At UVA, we have a team of operations pharmacists and technicians that are highly skilled in preparing, checking, and dispensing all intravenous compounds for the medical center. They're preparing doses that go to inpatient units, the ER areas, and the OR. We prepare all hazardous and non-hazardous medications using aseptic technique and laminar flow hoods, as well as biological safety cabinets. They're using unique workflows such as the dispense queue, which allows them to make real-time decisions and prepare doses closer to the administration times to decrease waste for the medical center, as well as using barcode scanning, dispense prep and check, and barcode administration for medication safety purposes. The IV room team supports the academic medical center mission to precept APPE and IPPE students as well as residents in the ways of sterile compounding workflows, as well as the importance of sterile compounding compliance in the clean room. The IV room team, both pharmacists and technicians, really take pride in precepting for students, residents, and training staff members in the workflows to help create a more interconnected department between operations and clinical practice.
So we believe that the practice of pharmacy is not just about metrics, it's not just about volumes, it's certainly not just about the financial gain that we can get from it. We believe that the practice of pharmacy in the community setting is a way that we can make our patients healthier. It's a way that we can affect their lives. It's a way that we can provide care for them that nobody else can provide. And as a part of UVA Health, we have the resources, we have the mission, we have the ability and the willingness, and more importantly, we have the team of people who have the right mind about what it means to practice pharmacy at the top of its game, to be able to take care of patients that nobody else can take care of, to give those patients care that nobody else can provide, and to make sure that we can make their lives better.
This department having a medication utilization strategy at a hospital is pretty unique. We have something that not a lot of large hospitals have. So coming here, you'll be able to work with several individuals with a bunch of unique experiences in this area. Our role here is to ensure that we have a safe, effective, and financially responsible formulary here at UVA, and we also make sure that we control or evaluate all the drug shortages.
Our office is right across from the Peds pharmacy in the inpatient pharmacy. Connected to our office space, we have our drug room, where we keep all of our investigational agents that are distributed throughout the hospital. That has space for room temperature drugs, refrigerated drugs, frozen drugs, extra frozen drugs.
Whenever you have an exposure to this type of environment, it's a unique area to work in, so you're not going to see it everywhere you go. But when you are able to understand and appreciate the work and the detail that goes into what we do, they can carry that forward. There's a lot that they can apply to how they're going to do their research in the future. Even if they decide not to do investigational drugs as a professional career goal, they can take the detail orientation, the organizational aspects, and carry that forward in their own research.
We recently opened up a new pharmacy which includes IDS. We moved from the 2nd floor to the 4th floor of the Cancer Center, and we quadrupled our space. We are increasing the number of open trials we have every year and the number of patients. So just having a nice new space has been really great for us as far as just our current needs and just future planning for growth.
So our space is pretty unique. It's a very large space. We have a typical outpatient pharmacy type space for the fulfillment of medication orders. We do have more refrigerators in most pharmacies because most specialty meds are high cost and they're refrigerated. We have a bunch of freezers because we mail all of our medications through UPS, and so we have to worry about cold chain. We have a lot of packaging supplies to fulfill the shipment of our medications, and we have areas to do the packaging. We also have a lot of office type space with medication authorization techs in there, as well as office space for pharmacists who are providing these clinical assessments and follow-up care. Specialty pharmacy is a growing niche of pharmacy. It's becoming ever more present. With the current landscape and COVID, mail order services are very valuable, especially for patients with healthcare needs. So we are expanding rapidly to meet the needs of patients across the state of Virginia and multiple other states that we're able to ship to.
We opened this new tower standing behind me last year, and with the new tower came a lot of new technology. UVA Health specifically invests a lot of time and energy in providing some of the more high-tech technologies in healthcare, and it is certainly beneficial to learn at the peak of where our technology is. It helps to streamline the process of everything that you are doing, so it makes patient care certainly more safe and also more efficient. One of the greatest experiences here at UVA is our opportunity to work interdisciplinary with our other disciplines in the healthcare system, and everybody's very open to participating in dialogue with pharmacy. I've thoroughly enjoyed my time at UVA, and I think it goes back to all of the relationships that we have. There are definitely a lot of reasons to say, but I think that the biggest one was truly the UVA family.